the only ways it could be more birth centers and more home birth providers is if we start acting like we belong in that space.
Yes.
So you speak loudly, you speak up, you don't hold back any punches. You also are using this position as a leader of a major national organization to further this goal. What do you think people without that much influence can do? What are some of the steps that they can do?
I believe that consumers really have a lot of power, especially if they band together and have a collective voice, which I think is the other side of the coin, right? I think midwives and birth workers need to start standing up and speaking the truth with power and really hitting home. I think it's a cultural thing. We have been acculturated in the mainstream American culture to be polite and all of these euphemisms, bridges and put your hand across the thing and da da da. I know that in our country, we're in this extremely polarized time politically. So I'm not talking about that kind of stuff. I'm talking about we need to stand up and start saying, like, our country is killing people. It is dangerous to be pregnant in this country, particularly if you are a member of BIPOC community, right? The data is irrefutable. And I think we need to start, shouting that from the rooftops and being very clear when we talk about that data. Where does that data come from? It comes from the medical industrial complex. These horrific outcomes aren't coming from birth centers. They're not coming from home birth. They're not coming from midwifery models of care. They are coming from hospital-based physician models of care. So they need to own these outcomes, and we need to make them own these outcomes so that we can really start to look at the things that we know that work to improve the outcomes. I'm so frustrated when people are like, oh, home birth center isn't safe. I'm like, no, what is not safe irrefutably is the current mainstream medical system, right?
It's really not. It's really not. It's unethical.
Yes.
It's unethical. It's a human rights violation.
And so I think we need to say it as the providers and the clinicians, or whatever kind of term you want to use, but we also need the consumers to stand up as well. We can do our part, but the consumers are that critical piece that also have to start getting angry and mad. And they are, it's happening, but it needs to continue to grow and build momentum and really start to demand it. Unfortunately, our current healthcare model is for-profit driven, which never should be. I feel very strongly that healthcare should be nonprofit.
Absolutely.
I am born and raised in America. I believe in many aspects of the capitalist system, but I don't believe that it serves us in any way, shape, or form related to healthcare or education.